Hi guys, welcome to another episode of Holameds, powered by R.A. Williams. I'm your host, Kimberly. October is Oral Health Awareness Month, and we're celebrating under the theme, Be Proud of Your Mouth. So, to help us all be a little prouder of our mouth is good friend of the show, Dr. Tiffany Francis of All Smiles Dental Care. Thank you so much for joining us.
Thank you for having me, Kimberly.
You
Great
look
to be here.
gorgeous.
Thank
This
you.
orange is
You too.
everything. Thank you.
Fall. I'm channeling fall.
I love it. I love it. It's working. All right, so let's get into the teeth of the matter.
All right, ready.
Why is oral health important?
Oral health is the health of the teeth and the gums. And it's important because the mouth is the gateway to the body. And we use the teeth to eat, for smiling, for speech. And if we don't take care of them, then all of those things will not be okay, right?
Yeah. And smiling is important, right?
Definitely.
All the
It
time.
builds confidence in children and in adults.
Absolutely. All right. So, what would you say are some general must-do tips? Like these things must be done for you to have good oral health.
All right. Brush your teeth daily, twice a day. If you can do 3 times, it's even better. Flossing daily. If you don't do daily, I say give me 4 times a week. All right. Visit your dentist at least twice a year.
Okay.
If you miss twice, get in once, not every
once.
2 years, right? Ensure when you go to the dentist, you get your checkup. If you haven't done x-rays, you do those. You get your cleaning, and anything that else you need to be done, attend to it.
Why are x-rays important for your teeth?
Oh, well, all right. Clinically, as in when we look in your mouth, there are certain things we can't see. And the x-rays help us to diagnose or see cavities that may be forming between the teeth, which are like hidden cavities.
Okay.
Right. It also detects bone loss and gum disease, things that we may not see at the early stages. So it's definitely good at least every 2 years you do x-rays.
Proactive, sort of.
Definitely.
Yeah. All right. Are there any types of medication that you say would affect your oral health in a negative way?
You have some. You have some meds for like hypertension may cause dry mouth, and dry mouth means that you're more prone to getting cavities because you don't have enough saliva to kind of allow the food to pass through the mouth, and then with dry mouth you have a tendency to get tooth decay.
Okay.
Right. So hypertension meds, some meds that persons takes for seizures or fits can cause irritation to the gum. The gum can start to overgrow, right? Or they may be more prone to gum disease.
Okay.
Right. And then there are certain antibiotics, not so much nowadays, but back in the days, if a pregnant lady took it, it may affect the developing teeth of the growing.
The newborn?
Yeah.
The baby?
The baby.
Well, that leads me to my next question then. Are there, for pregnant women, are they affected by the pregnancy, their oral health that is? Are there any special tips for them?
Yeah, definitely. Pregnancy hormones can cause you to be a little bit more reactive to gum disease.
Okay.
So say, for example, you're going about a day, you're not pregnant, you may not react to plaque buildup and not brushing your teeth as much as a person who is pregnant. So the gums are hypersensitive sometimes. Due to these hormones, you may get what we call pregnancy gingivitis, which is like an overgrowth of the gum. Sometimes if they have a lot of morning sickness and a lot of nausea, vomiting, it may cause erosion of the teeth. Or they might develop a habit and only eat mints, sugar mints, and then what you end up with total breakdown of the teeth due to the constant exposure to the sugar.
Okay. And what do you do? What do you recommend in that scenario if you're pregnant and you realize that, boy, this morning, afternoon, evening sickness, just
everything?
Yeah.
Visit your dentist at least within the first trimester, right? You probably feel I don't want nobody in my mouth, but at least go there, get a little checkup. If you can manage to do a cleaning, we most times we don't do x-rays during pregnancy unless it's like a really bad toothache and we need to figure out what's going on.
Okay.
But get the visit in, get a cleaning done so that you can help to prevent it from getting really bad throughout the pregnancy.
Okay. And then I guess after the pregnancy then?
You come back in and we can finish up things that maybe you weren't comfortable with.
Understood.
Yeah.
All right. So we've gotten through the pregnancy. The baby's now here. When is a good time to take the little one to see the dentist?
I say, or people say first teeth, I say 1 year old. So we
Okay.
just generalize it. You might have 2 teeth, 4 teeth, or some of them come with 6. And the important thing is
Right.
more for the parent to develop good oral health habits.
So the first visit is for the parents, not necessarily the
For the
child.
kid. Because you're not going to do much. We're going to look. We're going to talk with the parent to say, hey, what have you been doing? How have you been taking care of these teeth? What are they eating? Because a lot of times parents end up feeding their children constantly through the night once the teeth come up. And we get what we call early childhood cavities. And that's a big deal. So when you're 2 with all the teeth rotten, we don't want that.
That's not a good look. You're not going to be proud of that.
We don't want that, you know.
Right.
So we want you coming at 1 so that we can be on track and the child can get used to the environment and you can be well informed as a parent.
Okay. So it's just to encourage good habits at that stage.
Definitely.
All right. We wanted to play a quick game of fact, fib, or fad.
All right.
All right. We love games here at Hola Mids. All right. So the first one is you should brush your teeth after every meal.
Fact. But if you don't, I wouldn't report you. But at least twice a day and at least before you go to your bed.
All right.
Right.
Candies give you cavities.
Any candy with sugar in there? Definitely.
Say
Fact.
louder for the people in the back, please.
Any candy with sugar in there? Fact. Give you cavities. Excessive consumption of candies.
Okay. All right. Activated charcoal whitens your teeth.
Fad.
It's a fad.
It's a fad. There's no clinical evidence that charcoal whitens your teeth. Maybe what it might do is scrub away the stains, which you probably would get if you use anything with a grainy, which you shouldn't be doing.
Anyway, okay. All right. Teeth are the hardest part of the human body.
Fact.
Fact.
The enamel, that pretty shine white part, the enamel is the hardest substance in the body.
Harder than bone.
Yeah.
All right. Your toothbrush, and the older folks may take offense to this one. Your toothbrush should be hard and sturdy to maintain good oral health.
Fib.
It's a fib.
Right. It should be soft to medium and preferably a flexible head.
Okay.
Right. Hard brushes rub away the outer surface, the enamel, constant exposure to it, and can cause what we call recession or little wearing marks on the teeth. So stick with a soft to medium. Right.
Okay. So for the people who say, I don't feel like anything going on, something's actually taking place with a soft to medium toothbrush.
To me, an automatic toothbrush is the way to go nowadays. And they have all sorts, you know, they're very expensive and to not so expensive ones you have to change batteries, one that you can charge. But that definitely gives you a better handle on removing plaque and tartar buildup on the teeth.
Okay. All right. Our last question is, fluoride is essential to good oral health.
It is. It's very important. It is a fact. And it's more beneficial in growing kids or teeth that maybe are starting to break down but haven't developed cavities. But it's definitely, the benefits outweigh the risk when used properly.
Yeah.
Yeah.
All right. This was very edutaining, I must say. My last thing would be to ask you, what does be proud of your mouth mean to you?
Be proud of your mouth mean that you take responsibility for it, right? You understand the value of your mouth to you. You know, some little kids, if you tell them you don't brush your teeth, you're going to lose them, you can't eat chicken, right? You know, and that's a child, you want to eat everything. But an adult, you may say you lose the teeth, it means that they can't smile, it means their confidence is gone.
Yeah.
You know, speech, all of that comes together to make you as a person a better person. So being proud of your mouth means that you understand the value that it is to you.
Yeah.
Yeah.
Thank you so much.
You're very
welcome. It's a
welcome.
pleasure. There you have it, guys. Be proud of your mouth. Ensure you go to your dentist, and you can reach Dr. Francis at All Smiles Dental Care, 17 Holborn Road,
where we make it easy.
Easy. Thank you so much, and we'll see you next time. Until then, go on, Hola Mids.